Shalom, this is Graciela Salinas, and today we're going to talk about informed consent. So what is informed consent? Well, let me just tell you that the informed consent is a process of communication between the patient and a healthcare provider that results in the patient's agreement to undergo a procedure or treatment. So there are two kinds of informed consent. When a patient is admitted to the hospital at the beginning of admission, usually they sign a global consent so that they can be treated in the hospital. However, if there's going to be an invasive procedure, then a second informed consent is necessary. And usually the physician, at least in Texas, the physician needs to get that informed consent from the patient. But this is both a legal and an ethical obligation. The provider, the physician, it doesn't have to be the physician, but it could be also the nurse practitioner or the psychologist or psychiatrist. When they're going to provide the treatment, they're the ones who need to educate the patient about the benefits, the risks, and alternatives to the intervention. So informed consent is required for any invasive procedures, like I was saying before. These procedures, maybe the ones that require sedatives or anesthesia, or non-surgical procedures that carry a high risk, like blood transfusion, or procedures that involve radiation. We, as nurses, are key participants in the informed consent. Our role mostly is to educate the patient and verify the understanding. But remember, it is the provider that talks about benefits, risks, and alternatives. We can educate about what the procedure entails, what's going to happen during the timing in the surgery and things like that, how to prepare the patient for it. But once more, benefits, risks, and alternatives is the responsibility of the healthcare provider. So going forward, what is the background? Why do we have to? Well, the concept of informed consent in healthcare usually calls to mind the written contractual acknowledgement form signed by a patient or legal representative in advanced care, before a procedure. Legal restrictions on who can obtain informed consent varies by state, like I was saying before. So in Texas, nurses can witness it and can educate, but that we cannot obtain the consent. So we have to make sure that we are aware of the policy, whatever we're gonna practice. So if you're gonna be in Texas, you know, you cannot obtain the consent. You can participate, but not obtain it. Informed consent, like I was saying, is a process. It goes beyond the paperwork in which the nurses must fully understand their legal, moral, and ethical roles. The historic perspective about this is that paternalism played a significant role in the history of informed consent, as it allowed the surgeon, nurse, or family members to set aside patient preferences in care and assume that others will make the most beneficial choices on behalf of the patient. In the past, some consider it undesirable to discuss the possible risks or negative outcomes with patients for fear that it will increase their anxiety or make them less likely to consent to life-saving procedures. The ethical and moral considerations, we have talked about ethics before. Maybe you have heard about ethics before. The word autonomy in relation to informed consent is the moral right of the patient to make their own decisions. So we have said it before, he has the right to accept, select, or refuse care. The nurses, we and the physicians, we can support the patient autonomy by using neutral language and not emphasizing benefits over risks. So whenever we teach, we have to remain neutral. The roles that we play as physicians and nurses make it imperative that they exercise the discretion, or that we exercise discretion and fairly represent balanced information to patients, particularly during the consent process. And then the other part of ethic and moral consideration is self-determination. That is the ethical principle which supports providing patients with the facts necessary to make a rational decision on their own behalf. So it is our duty to be honest, truthful, and upfront of what's coming up. On patient education, we are supposed to have an assessment during admission, and in that assessment, we should be including patient education. So what does that entail? Well, assess and understand the patient's cognitive abilities, the knowledge of their condition, their learning styles, and allow for appropriate interactions and successful nurse-patient relationship or nurse-patient education. Nurses, we spend more time educating patients than most other healthcare disciplines. So we feel a role that we have to earn that trust. That's why they see us as one of the most trusted professions, because they see us as part of their team, that we are on their side as a patient caregiver, as an advocate, as an educator, and as a steward. So during the bedside care, we need to be asking the patient and the family to answer questions related to upcoming procedures and surgeries, and provide key information about the upcoming procedures and tests. We also need to consider the factors such as pain, anxiety, the disease in question, and therapeutic interventions, as this may hinder the meaningful participation of patients in the decision-making process. So, just to give you an overview of what informed consent is, at its core, informed consent requires patients to be aware of the risks, benefits, and alternatives that are supposed to be taught by or explained by the healthcare provider of whatever, if it's a surgery, an intervention, or a treatment, and give the opportunity to ask questions. The process of informed consent is very complex and may require the participation of multiple parties, and usually begins well in advance of the point of obtaining a signature on a form. The sign and witness informed consent form is the legal obligation of the physician or advanced practice provider performing the procedure in question. I have mentioned that before. The nurses are usually charged with verifying the information consent paperwork that has been obtained just prior to surgery or procedures. Consent should never be considered a waiver of liability. Patients have the right to know who is performing their procedure, as well as how many times the person has successfully completed this procedure. If the nurse believes the patient has not been fully informed or has less than a full understanding of the proposed treatment, the nurse must act as the patient advocate to ensure that the patient receives the necessary information. There is some specific terminology in informed consent. Let me just go over a few. Informed decision-making. That can be completed by a patient with the mental capabilities to understand the decision to accept or reject the medical treatment being offered. Again, the patient has to be able to make that decision, have the capabilities to do it. Decisional capacity is a patient who is unconscious, disoriented, or delusional, and may have a surrogate to assume the decision-making process or authority for providing informed consent on their behalf. Healthcare surrogate is a person designated by the patient to make healthcare decisions should the patient become incapacitated. Substituted judgment. In the event that a patient lacks the capacity to make decisions on their own, statutes in many states allow for the assignment of a proxy to make decisions who must consider any and all known wishes of the patients. So the final point that I want to make, refusal of consent. It is within the rights of the autonomous patient to refuse a recommended treatment, even if we do not agree with that, even if we think that that is not the best decision for the patient. If the patient refuses, then our role is to make sure that they are understanding the consequences of their refusal, so we can document that he made an informed or an educated decision. A competent patient may verbally withdraw consent at any time and refuse to continue a treatment pathway, even in the presence of a signed consent form. So remember all this whenever you're answering questions on the NCLEX about informed consent. The main key is, number one, the physician or healthcare provider is the one who has the responsibility to talk about the benefits, the risks, and alternatives to the treatment. Number two, as nurses, we have the duty of educating the patient and making sure that they are fully aware of what's going to happen during that procedure or treatment or surgery they're signing. Number three, patient has the right to refuse, even if we don't agree with that. And number four, the patient can withdraw that consent at any point, even after they have signed the consent. So I hope that this has helped you understand a little bit more about informed consent, and I'll see you at the next presentation. Shalom.